Well, if you're living with spinal pain, you know what? You shouldn't be. There are new therapies and procedures available to get you the relief that you really need in order to live a productive life. Dr. Rainer Kremer from AZ Pain Centers is talking about the spine and the joints in and around the spine, and they're called facet joints. Is that right?
Correct.
Okay, first of all, tell us, in order to really understand the spine in the back, tell us a little bit about how the spine really works. I mean, we know basically what it does.
It is a flexible column made up of vertebral bodies in the front and then facet joints in the back that provide mobility and flexibility to the spine. And then it has cushions or shock absorbers between the vertebral bodies, and those are called intervertebral discs. The areas that we're going to look at today are the intervertebral discs, the nerves that come off the side, and the facet joints in the back.
Okay, let's talk too about sometimes your back will hurt, but also other body parts will hurt as a result of it. Is that something normal?
Well, what happens is when there's wear and tear in the disc, some of that material can ooze out and put pressure on a nerve, or if the facet joints wear and tear over time, they will put pressure on a nerve.
Okay.
And even though the problem may be in the spine, you can get referred pain down into the arm, into the hand, in the shoulder blade, or you can even get headaches. In the low back, you can get chronic low back pain because of the facet joint pain. And if the nerve is irritated, you can get pain that goes down into the foot and into the leg.
Yeah, and I've actually heard people mention that their feet will tingle or their toes will tingle.
Correct.
A good indication
Yes.
that there's something going on in the spine. Let's talk about how it's what we're really experiencing, because we have kind of an example here of what is this little red thing here?
Well, that is an example of a protruding or herniated disc that is actually putting pressure on a nerve root.
So it literally bulges like
it
that
actually
in your body.
bulges, and it displaces the nerve root where the nerve root comes out from the spinal column. When that happens, that nerve is irritated. It's kind of like hitting your funny bone. And you're getting that electric-like feeling, or we call it paresthesias and dysesthesias, kind of this weird electric feeling in your foot, or if it's in your low back, which is most common, or down your arm if it's in your neck. And we would focus on trying to reduce the inflammation that causes the swelling around the nerve and reduce the displacement of that herniation.
Well, the good news is that there is something that you can do about it. So how does AZ Pain Centers go about, what approach do you take in order to help us feel better if we have something like a herniated disc?
Well, first of all, we encourage our patients to keep moving, because for chronic low back pain, movement is medicine.
I love that phrase.
Yeah, movement is medicine, because most of chronic back pain goes away with additional activity, takes a few days, muscle soreness. But what we're looking at is that pain that isn't going away. Is it due to an injury? Is there a fracture? Is there a nerve that is irritated or being impinged? Is there referred pain? We'd like to see those populations with chronic irretractable pain.
You also, speaking of pain, their procedures, are they painless?
We use comfort technology, and we try to adapt our procedures for each patient's pain tolerance. We use non-steroidal and low-dose steroidal treatments to mitigate and reduce the inflammation and break the pain cycle.
All right, you're looking at some of the other body parts there. Speaking of elbows there, the AZ Pain Centers treats, basically the important part is that you go in and get an evaluation, and that's the first step.
And find out the source of the problem.
There you go. I like that. Thank you, Dr. Kremer. Appreciate that. For more information, you can go to azpaincenters.com, or you can also call the number right there on your screen. They accept most insurance plans, and they have locations actually statewide. For Tucson, call 520-742-PAIN. You can also call 844-REGENIX. That's 844-734-3639. Thanks, Dr. Kremer.
Thank you.